Hey guys, and welcome back. My name's Kris, and today I'm going to be talking to you about why I chose to become a general practitioner. Now, this video will be much more catered towards those who are in the medical field, but if you're curious as to why someone would choose to be a GP, you may find it interesting too. Regardless of where you sit, I'd really appreciate it if you watched this video all the way to the end, gave me a thumbs up or a thumbs down if you didn't like it, leave a comment, subscribe, all that YouTubey stuff because it does help, and I am really enjoying making these videos. So let's get the most common reason out the way, shall we? The lifestyle. Yes, GP is what you make it to be. So currently I work 8 to 6, Monday, Tuesday, Thursday, Friday. I'm still working a 40-hour week, but I do have that flexibility of Wednesdays off, which, fun fact, is usually when I film these videos, edit them, and have them ready to upload for the next month. I bulk film things, if you couldn't tell by the fact my face doesn't change like 4 videos in a row, but I digress. The lifestyle in general practice is whatever you want it to be. If you wanted to work 9 to 5, Monday to Friday, you can. If you wanted to work only 8 to 12 every 3 days, you can. Weekends, you can. After hours, you can. There are so many options with general practice that unfortunately a lot of other subspecialties don't have. We don't have on-call unless you work in like a doctor-to-you service or an after-hours doctor service. We don't have emergency cases often. We sometimes do, but not often. We don't have the grueling on-call schedules. We don't have the shift work that other subspecialties do. And it's part of what I love about general practice, let's be real. I did shift work for 2 years and it's not a long time, granted, I know that, but it was awful and I'm so glad that I'm no longer doing it. Me, as Kris, as a person, not cut out for that, and I really applaud those who do. Think about emergency medicine doctors. Quite often they're on shifts forever. And yeah, anyway, I could talk about that a lot, but yeah, one of the main draws to general practice is the lifestyle and the flexibility. When you are a fellow GP like I am now, you quite often are what we call a contractor, or you're your own business that gets contracted out to a general practice hub, essentially, so the clinic that you work at. I set my own hours. Yeah, there's an agreement between me and the person who hires me about what is expected, but if I say I don't want to open my books on Tuesday afternoons, I don't have to. The fallback is I don't get paid if I don't work. There's no salary, there's nothing like that. I get paid for the stuff I do, but that suits me better than, you know, shift work and after hours and emergency call-outs and stuff like that. So yeah, lifestyle. Number 2 is the main reason I actually really love general practice, and that's the genuine connection you make with your patients. I love, my favorite type of patient is when I see a woman and her partner for the first time and they've fallen pregnant. 9 months later, I then meet their child. And then a few years later, well, even a few months later, I'm immunizing that child. I'm watching them grow. I'm then seeing them go to school. And yeah, I've only been practicing for a couple of years, so I've not gotten to that point yet. But that to me is just so lovely. It's that continuity of care and the genuine connections you get with people. I love being able to see you for your stubbed toe, and then about your anxieties, and then about the kidney infection you had, whatever. I just really enjoy the fact that when you sit down, I can ask you about your trip you went on because I have that connection with you. When I worked in the hospital system in other subspecialties, quite often you see that person for a period of time and you hope to never see them again because it means that they're better and someone else is looking after them. I like being that someone else, I really do. When you work in emergency, you work someone up, you figure out what's best for them either right then and there or in a referral sense, and you hope to never see them again because that means they're going through the ED again and you don't want that for people. When I worked at obstetrics, you'd see people, you'd help deliver their baby, and you'd never see them again unless they fell pregnant again and were going through the service at the same time as you. There's just no continuity there. So yeah, the second reason is the genuine connections you make with people and the continuity of care. And it's really the reason why I love general practice. Reason number 3, a bit controversial, but I basically want to dispel the myth that GPs don't make money. We do. It's really hard to talk about money because I I know I'm coming from a place of privilege, but a lot of people assume that GPs don't make a lot of money. The thing is, there's a wide spectrum of money that you can make working in general practice. And just to put it frankly, I'm comfortable. I really am. I work 4 days a week and I live in a house that I own in a comfortable lifestyle, and I'm not struggling. That sounds really awful, I know, because there are people out there who are struggling. But the myth is, and the rumor is, that you go into GP and you get a massive pay cut, and that's not the case. So it's not really a reason to choose general practice, but it's a reason not to not choose general practice, if that makes sense, which I'm sure it doesn't. Two negatives make a positive, right? But essentially, number 3 is you can live a very comfortable lifestyle in general practice. It does depend on how many hours you work, the kind of work you do, do you work in a bulk billing or a private billing practice? There's a lot of reasons why one may make more money than another in private practice. The same goes for private surgeons, private obstetricians, private dermatologists. So, it's really hard to talk about money because it's so varied, but it's not a reason not to choose general practice. Reason number 4 is the wide breadth of subspecialization you can do as a general practitioner. I know GPs who fellow and then only do skin cancers. They're not dermatologists, they're not plastic surgeons, they're not general surgeons, but all they do is skin cancer. And to them, that's what they want to do, so that is fantastic. They learn to do much more complicated procedures than I myself as a very junior GP would do. They learn to spot diagnose skin cancers at a much higher accurate rate than what I can do at the moment. It's because they love it. GPs also often go into aesthetic medicine, and they do injections and the cosmetic types of things. And again, they're not plastic surgeons, they're GPs with a love and passion for it, and that's all they do because they want to. What I'm trying to say is you have a choice. I know GPs who only do women's health, sexual health. I know GPs who essentially are just diabetic GPs, and that's fantastic. I love the fact that we can subspecialize if we want to. I personally don't want to subspecialize yet. I love general medicine. I love seeing diabetic patients, chronic kidney disease patients. I love seeing healthy people. I do see a lot of mental health as well, but I don't want to subspecialize as of yet. I love the variety. And I guess that's kind of reason 4.5 about GP is the variety. You never know what's coming through the door. You never know if you're going to do a smear test, if you're going to have someone who might be having a heart attack, someone who's pregnant and didn't know until that morning, someone who's just had a baby, someone who's got a mole that's changing. You never know, and it's so fun. So I really, really do love the variety and the option to subspecialize in GP. And reason number 5 why I love general practice and why you should consider it is how collaborative it is. As a GP, we're often the hub for referrals and correspondence from subspecialists like surgeons and endocrinologists and psychiatrists, for allied health professionals like physiotherapists and psychologists. We are the person who can coordinate all of that. We talk to pharmacies about the best way for patients to have their medicines. Should they be in a Webster pack? Can they get them every week, every month, every 6 months? We are the people who can coordinate so much, and it's so fulfilling being able to, at least for me, go through and go, right, I've done this, and this for you. Right, what's next? Yes, it may seem like all GPs do are coughs, colds, smears and tears as they call it, but honestly, it's so varied and I love it. I love being able to coordinate care for people. I love the connections I make with people, and I'm really happy in my job. So, of course, me being happy in my job doesn't mean you will be, but at least consider it. And if you're not in the position to consider GP as a career because you're not in the medical career or you're very happy in your other subspecialty, please do recognize the importance of a good GP for yourself and for those that you love or work with or work for. Anyway, this is going to go all ranty if I leave it any longer, so there you have it. 5 reasons why you should consider GP, or 5 reasons why I love my job. If you have any questions, of course, I'm happy to answer, but until next time guys, stay safe, stay healthy, and I'll see you later. Bye bye.